I'm
Yeah.
curious, why do you think, well, just for the layperson even, please explain what the technology is and how it can help people.
Yeah,
Maybe
so the
go into a
technology,
little bit of the history of how it came to be and how it's changing lives now. Please share.
yes. So QRS, it stands for Quantum Resonance System. It is a technology. I think we should not talk too much about how it works. I will try to do that. But the more important thing from my point of view is always the effects of what it is actually doing. If you go to a doctor and he prescribes you some medicine, you're normally also not going to ask your doctor, well, what exactly is in it? The doctor tells you it is good for you, you take it, and you measure after 1 or 2 days whether it is helping you. And that is also what you have to do with the QRS. What are the proven biological effects? You mentioned the word evidence-based. So I also use that word often. This is not something like alternative medicine, and it is still being kept in that corner. Well, that's some alternative medicine, etc. From my point of view, this is all proven complementary medicine. There's really hundreds, actually thousands of clinical studies, not all like super high quality, but there is some real serious high quality studies depending on indication. But back to your question, just first, later I explain about the proven effects, which is more important. I try to summarize what does the system actually do. So here I've got like one, I think this is just one applicator. So PEMF system normally gets delivered with various applicators. This I call a pillow applicator. So if I start that system, it's very strange because if you start the system, you hold your hand on it. Normally, most people, 95% of the people, they say, I feel absolutely nothing. So you hold it and they ask me, is it working already? Is it working already? And yes, it is absolutely working, but they feel nothing. So many people in their brain, they are already convinced this is absolutely never going to help me. How is it possible? I make a lot of big claims. I do not only talk about pain management, and I have to be careful with interviews, especially in USA. So I want to stress that we QRS, we never make a claim that this can actually cure you. Very important. So I absolutely do never make a claim this can cure cancer or something, or cure diabetes, etc. However, if you use this, first of all, it is more preventative therapy. I will explain that later. But people who are suffering from chronic diseases and you are going to use QRS as a complementary therapy, you are normally always going to see positive effects. Sorry, I got a little bit away from your question. So how does it work? That was your question. If you start it, normally you don't feel anything. What it is using is pulsating, positive, negative, pulsating magnetic fields. And I stress the word magnetic because it is something totally different than electrical stimulation. There's nothing electrical here, which also means it is 100% safe system. If I have a pacemaker, for example, I keep this to my heart. Nothing is absolutely going to go wrong. With electrical stimulation, you have to be careful. There's all kind of side effects. So I repeat, it is pulsating magnetic field. So not like a static magnet, like on your fridge, but it is like positive, negative, positive, negative, positive, negative, under patented frequencies. But these frequencies are patented, but most of them, they are very, very low, soft frequencies. And these frequencies, they mimic, very important word, they try to mimic the frequencies of nature and the frequencies of your cells in your body. Everything in the world is energy. Everything is frequencies. So if I talk to you, this video that we take, everything is being broadcast via frequencies. Also your cells, your body, your brain, everything works in certain frequency ranges. And this QRS, it tries to resonate, quantum resonance system. It tries to resonate with the natural frequencies, with your original frequencies, so that your cells, as you get older, your cells often are not going to function so good anymore. Your cells start to produce lower energy. Your cells start to resonate in lower frequencies. The key purpose of QRS is to resonate back so that all your cells start to work, to function better with this pulsating magnetic field. It penetrates through all your cells in your body. So if you hold it in front of you, for example, it's not just that it works superficially here on my chest, it really penetrates through my whole body. I can measure it 2 meters further. Every cell in your body, really every cell from your brain until your toe, every cell starts to interact with that pulsating field, starts to produce more energy, starts to function better. So your brain cells start to function better. I will later explain how exactly that works. Your kidney cells function better. Your really every cell, your heart starts to function better. It's a very short answer to your question. How does it exactly work?
So as we age, does our magnetic field, when we get older, does that magnetic field tend to go down or